On this episode,
Her mum's very upset.
traumatised Poppy has been viciously attacked by a bigger dog.
Look at that. Gosh, it's horrible.
Tim tries to save a new mum
Oh, you got another tick. I just felt it. Where was it? There.
who's desperately unwell and can't care for her baby.
She's ripped that on something?
Yeah, she must be in so much pain there.
And the heartbreaking case of little rescue cat Candy.
That's what she does when she just can't concentrate enough to walk.
My sweetheart.
You make my world a better place.
Come on, there's your girl.
I can't depend on you.
Hey, this is Poppy. Poppy just got attacked while on a walk by a larger dog.
On the Gold Coast, vet nurse Tracy is rushing in an emergency patient badly bitten in a fight.
There on the right side.
You can see she's got
Her mum's very upset.
We couldn't get the dog off Poppy. It was horrible. Just crying and yelping, and we just literally couldn't get the dog off. It was traumatic.
In the waiting room, Poppy's mum Jackie is distraught after the sudden attack by a dog 3 times Poppy's size.
She was just out on a walk, was
Yeah,
she?
on a walk, on a lead.
Jackie and her husband Andy say Poppy means the world to them.
You're gonna make me cry.
She's our little girl.
Yeah,
That's it.
Poppy means everything to us.
We don't have kids or anything like that, so she's our baby, so to speak.
Yeah, she's our
She-
baby
so-
girl. We hope she'll be alright. She's in the good hands of the guys.
Yeah, I can see this wound on this side. Oh, that looks nasty. A lot of blood there, and I can actually see right down to the tissue. And if that's a larger dog, that could have gone quite a way.
Alex is immediately worried the dog bite has caused a deep puncture.
I can see there's a big hole there, but there's so much fur there, it's actually quite hard to see what's underneath. We're actually probably going to have to clip that hair away. But even from what I'm seeing at the moment, I'm really concerned with how bad this bite wound is. All right, sweetheart, I'm just going to have a listen. I'm going to go the other side first. Good girl. Good girl, Poppy. Our heart's racing.
Yeah, she's very distressed, aren't you?
I think there's no doubt about it. We're actually going to have to surgically explore this. So what that means is we're going to stabilise her medically first of all. She's in shock at the moment, so she's going to need pain relief and fluids. And then once she's stable, we're actually going to need to take her to surgery, because my biggest concern is that it actually goes into her chest cavity. If it does go into her chest cavity, that's major surgery.
She likes cuddles.
If Poppy has suffered a deep wound, it could threaten major organs like her heart and lungs.
Such a good dog.
All right, we're going to look after you.
Come on, Candy.
Hello.
Hi, good morning.
Morning.
In Sydney, Alison and Audrey's first patient is rescue cat Candy. Carer Adriana has some grave concerns about the little orphan.
So what's wrong with Candy today?
So I run a cat rehoming service, and she's come into our care a few weeks ago with very poor balance. She was very unsteady on her feet.
Oh, look at your eyes.
So when she walks, she has a head tilt like this. Her head wobbles like one of those wobble toys, and we don't know why. We originally thought that was because of malnutrition. So we've been feeding her. She's now reached a really nice weight.
She has, yeah.
But her balance is getting worse, and she falls when she walks, and it's very sad, actually. She was down in the euthanasia list, and we thought that perhaps we'll be able to help her and hopefully find her a home.
We're just going to see how Candy's walking, see how she's placing her feet.
And that's
That's what she does?
that's what she does when she just can't concentrate enough to walk.
My sweetheart. So she's in a wide space and she's not liking it, but I think if we pop her close to the cupboard, she might actually be a bit better. Just to have that security of something next to her. She's more comfortable to walk.
Yeah, because she uses that to
Balance herself, yeah. Well, this definitely could be neurological because of the head tilt. An inner ear infection is another possibility. So there's a couple of tests that we have to do today. So we're just checking her placement. So I'm actually popping her paw the other way and see if she can right it herself. So this is one of the exams that we do just to check her nerve function to all her feet. Good girl. And so she corrects it straight away, which is a very good sign. So let's have a look in her ear. There's quite a lot of gunk in there, so we'll see. Might just get it clean. What is going on in here?
Some pain relief and it will feel better.
On the Gold Coast, Alex and nurse Tracy are treating 2-year-old Poppy, who was attacked by a bigger dog while walking with her owner.
She'll be alright. She's in the good hands of the guys.
Her mum didn't get bitten?
No, I think Mum sort of picked her up fairly quickly and
Got her out of the
hurried
way.
out of the way.
Luckily.
Alex has decided the wound to Poppy's chest is so deep she'll need immediate surgery.
Such are you holding my hand?
Good girl, Poppy. Oh, her eyes are all wide and worried. That's a big cuddle from Tracy. Is Tracy your new friend?
Yeah.
Her mum was just telling me before that they just love people, and when they find their people, they just want big cuddles. And I reckon
So
you're her
cute.
people.
I'm your people here? Excellent.
Tracy's TLC is helping to calm Poppy, while Alex puts the traumatised little dog on an intravenous drip.
This is going to get her started on fluids. Also, she's just about to undergo surgery and potentially quite a long anaesthetic. So we need to make sure that we are able to support her blood pressure, keep her well hydrated while she's under anaesthetic. There we go. Just gonna stick there.
But suddenly,
Oh, wow.
Alex notices Poppy's breathing has accelerated.
Just trying to get this done as quickly as we can because she's breathing up quite a lot now. Now, that could just be partly the stress. But my other worry is that bite is right over her chest. And if that's gone in and damaged her lung, then her lung could be starting to collapse. She could have bleeding into her chest. Any of these things are possible, and we need to find out as quickly as we can.
So we're just checking her placement. So I'm actually popping her paw the other way.
In Sydney, mobile vets Audrey and Alison are trying to find out why rescue cat Candy is struggling to stand up.
It's actually sort of a thick mucoid yellow colour in here. It's like a whole big gunk of pus. We're actually in disbelief that Candy is actually managing to walk at all. There is so much pus and discharge, crunchy, cruddy bits. It must be so uncomfortable and painful for her.
Just looks so nasty.
As soon as we put anything in her ear, her leg starts scratching and she starts shaking, so it's quite uncomfortable. It's almost like it's quite hypersensitive to any sort of stimulation.
So the ear is actually a very important part of what we call the vestibular system or the balance system. So if the ear is affected, especially the inner ear or the middle ear, that will really put you off your balance. You can't stand straight and it just makes you really dizzy.
The girls need more clues that will help explain Candy's condition.
So we've smeared the ear discharge onto the slide and you can see it there. And I'm going to give that a stain up, so put a few stains on it and have a look down the microscope to see if we can see any yeast or bacteria that might be causing the infection.
Alison is shocked when she makes an alarming discovery in the little cat's badly blocked ears.
There's a lot of bacteria there, there's a lot of pus and white blood cell. It looks like a bad infection, so we'll take Candy into hospital under general anaesthetic, give it a good flush out.
The best case scenario for me would be for her to find a cure to her problem and then find her forever home.
Carer Adriana wants to find Candy a loving new home, but the little cat's chances will be slim unless the girls can find out why she can't stand up or walk straight.
So let's take her back to the hospital.
And then hopefully we can get to the bottom of the infection.
You are not good right now.
Hey, Mr. Tim.
Go ahead, Hales.
Hey, could you come down to Koalas, please? There's a bit of an issue.
Roger. Now?
Please.
On my way.
At the Australian Reptile Park, Tim's answering an SOS from one of his keepers.
Hi.
Hey, what's up?
It's got an unwell koala.
Who is it?
This is Polly. A couple of days ago, she had 8 ticks on her, which is really strange.
Yeah.
She was found on the ground this morning. Her eyes were really puffy. I'm really concerned, just because she's got that little 6-month-old Joey in there.
Hayley's explained the signs that her and the keepers have picked up on. Mum's been on the ground, Mum's acting abnormally, Mum is constantly eating, Mum's a bit puffy around the face. They're all red flags in their own right, and we've got 4 of them.
Oh, you got another tick. I just felt it. Where was it? There.
Blood-sucking ticks are not uncommon in koalas, but if Poppy is infested with them, she could be suffering severe blood loss, which could lead to anemia.
If we have an unhealthy mum, one of the first things they'll do is abandon their Joey. It seems really odd to us, but marsupials, she'll abandon the Joey and in her mind she knows, I can have another one. It's wet, it's cold, the Joey won't last an hour outside of the pouch. We're gonna have to do something. I'm gonna go up and grab some equipment to weigh her, chip her and have a bit of a look, and I think you probably should start getting some pap.
Yep.
We've called the vet and Hayley is gonna begin the process of papping. When a Joey is born, the only food they eat is eucalyptus, but Joeys aren't born with the enzyme in their stomach to digest eucalyptus. So Mum makes herself go to the toilet until it becomes a runny substance, pap. The Joey eats it. If we don't get pap from Mum now, the Joey doesn't stand a chance.
She's breathing up quite a lot now.
On the Gold Coast, dog attack victim Poppy is breathing dangerously fast.
If that bite has gone into her chest cavity, then she could actually be in trouble with her breathing. She could have damage to her lungs. If it has punctured into her chest and we see air in there, we need to know about that before we go to surgery so we know what we're going to be dealing with.
Alex decides to do an urgent X-ray.
Pop you on your side. I really want that side down if possible. Okay, that looks pretty good. I can't see any fractured ribs on this view and no air in the chest, so good girl. And that's a good sign. I'm not seeing any air in the chest. Now, it doesn't rule out trauma to the lungs completely, but it's our best indication before we go to surgery that the bite hasn't penetrated into the chest. She's still in a lot of trouble, but from what I'm seeing, it could have been worse.
Surgery to repair the deep wound in Poppy's chest can now get underway without delay.
Look at that. Gosh. That's horrible. Pretty worried with what I'm seeing there with Poppy's wound. There's a big area of black, discoloured skin, which I think has actually died just because it was crushed for so long. We may have to remove a large amount of skin, and that's not going to be easy. All right, all I'm doing initially is just removing the dead tissue. And what I'm looking for is, has it got blood supply? Is it healthy colour? I don't want to remove any more tissue than I need to. Now we've got a huge hole that we're going to try to close. You're one lucky little girl, I reckon. I've had to pull the muscle underneath in. It's going to look a bit odd to start with, but it'll all be fine in the end as long as she doesn't go running around or doing anything crazy. But she's certainly going to have a big battle scar.
Hey, sweetheart.
Poppy will be closely monitored while she sleeps off the anaesthetic.
Look who's here. Your friend Tracy.
Hello. Good girl.
Okay, let's pop you down here.
In Sydney, Alison and Audrey's wobbly little patient Candy is now facing surgery.
So she's circling to the right. You can see she's actually bending towards the right, and she'll actually do some small and big circles as well.
The girls suspect her badly infected ears could be the reason why she's struggling to stand up straight or walk properly.
The worst case scenario with her is that it's actually a brain problem. You know, if there's something going on, she was born with a brain defect, that would be very difficult for her to live a normal life. It's pretty distressing to see how she's walking because she obviously looks quite dizzy and disorientated. And because she's so young and she should be playing and happy, it does make you really sad. It's heartbreaking.
So we're just going to give her general anaesthetic, and we're also going to take some blood just to look at her general health screen. Whoa, I did not expect that.
Okay. You're not liking the noise. Oh, that's fine. That's fine.
I think it was the noise, eh?
It was a noise.
The frightened little rescue cat is terrified of all the attention, but she urgently needs an ear flush to help relieve her pain and hopefully improve her balance.
So we're wrapping Candy up just so that she feels a little bit more secure and hopefully she doesn't jump out of our hands while we're taking blood.
I think because she's so uncoordinated in any position that she feels a bit uncomfortable or dizzy, she freaks out. So having sort of that pressure around her is going to make her feel a little bit more settled.
Taking bloods with a very flighty cat can be a little bit dangerous because you're with a pointy needle and they're running around the room. So you've just got to work around the cat, figure out a way that they're most calm and also keep the bitey end and the claws ends in, away from us. Good girl. You like it better line go. And I got her. You give me a fright every time you do that.
Eh?
Yep. So looking at the red, so the globulin is slightly elevated, sitting at 55, normal's 51.
Yeah.
And that isn't unexpected because usually that would go up if there's inflammation or infection.
Yeah.
So whether that inflammation or infection's in the ear or is it in the brain, we're going to have to get to the bottom of that and find out. So we're going to pop this little tube in just so we can get right down into the ear canal and then use some special flush with some antibiotics in it to give it a really good clean. We do have to be really careful because the end of that can cause some damage because it is so inflamed in there. So just guiding it in with my otoscope gently to get it to where I need to. All right, so we've instilled that in. Okay, maybe I'll have another quick look down before we start flushing.
The girls are now worried that the severe infection in Candy's ear is so bad it may have spread to her inner ear and dangerously close to her brain.
As I go deeper, I can actually see the eardrum has a massive hole in it.
Yeah, it's huge.
Come on, sweetie, come on. Pop, pop. Take your collar off. Oh, that's better. That's better.
On the Gold Coast, Poppy has recovered from emergency surgery after she was viciously bitten by a bigger dog.
It's okay.
I'm really happy with how Poppy is physically and she's ready to go home, but there's psychological damage that's been done from a dog attack like this. That could take months to heal.
Yeah, darling. Oh, good girl. Is that good?
It's always really great when you start to see them eat. It's one of the first signs that they're on the road to recovery. Even if you have to sit and hand feed them a little bit to tempt them, but she's loving this.
After some breakfast,
oh, good girl, Poppy.
It's time for the 2-year-old to be reunited with her adoring owners, Andy and Jackie.
He's in there.
Oh, sweet.
Hey, sweetie. We were a bit worried last night. My concern was that it had got deeper into her lungs, into the organs.
Just seeing her so happy was really good to sort of see that she's
bounced back.
Oh, definitely, after going through all of that. So,
Yeah.
you're a little legend.
Shake. Good girl. Oh, pause it. Yes, good girl. I feel like she's a little human in a little furry body there. So we're really lucky to have found each other. Thank you so much.
Oh, she was an absolute pleasure.
She's a bit of a trooper. Dr. Alex looked after you. Hey?
I can actually see the eardrum has a massive hole in it.
In Sydney, Alison and Audrey are shocked to discover the extent of little rescue cat Candy's ear infection.
Wow, she really doesn't even have an eardrum at all.
The kind of white shiny membrane that you would normally see covering the end of it is actually torn in half and there's a big black hole through it. So I think we found the reason why she can't walk straight and she just hasn't got any balance. I would guess it's probably a really nasty infection that's been left for too long and that tympanic membrane or eardrum has just ruptured. Did you see it?
Yeah, it's huge.
Poor thing. Awful.
In some way, this is bad news because she has got a very deep, severe ear infection that's been long-standing. But in other ways, it is good news because we can fix that.
Candy's ears are so badly infected, she's been unable to stand up properly or walk straight.
So now we're flushing out her ear, we're getting rid of all that crust and crud and pus, just trying to give it a really good clean out to get rid of all the bacteria there.
Oh, why do we always get the gory ones?
I know. All right, final check. Let's have a look. So, that is so much better. The oxygen's gone really low.
Yep.
I'm just going to give her a couple of oxygen ones.
Actually, is not taking a breath now.
More. Yes, more breath. So she actually stopped breathing for a little bit. We've just given her a couple of breaths of oxygen. If she stops breathing, her oxygen levels are going to drop, and that's really dangerous for her heart and her brain. So very important to keep an eye on it and address things quickly. She's back on.
So an eardrum will repair over time as long as you've got rid of all that infection and inflammation. These are just some antibiotic ear drops, and they're just going to clear up the infection and hopefully fix this problem. And then give it a bit of a massage, get it all the way down. Okay, should we wake her up? So it will take some time, but the good news is it will repair. All right, let's put her to bed, let her have a little rest, and then we'll get you home to Mum.
There you go, kitty.
How you going?
She's got the gaze and the spasming has started.
At the Australian Reptile Park, Tim and keeper Hayley are performing an unusual task. They're getting runny poo called pap from female koala Poppy.
Oh, look at it in there.
Can you see it?
Yeah. Are you happy?
Yeah, this is
got
the
it?
good stuff.
Look at that. Perfect.
Pap is essential for baby koalas so they can transition from milk to eucalyptus leaves.
Have you weighed her today?
No.
Okay.
But first, Tim wants vet Robin to check Poppy to see if she's well enough to look after her baby.
Yeah, let's weigh her today and see where she is. Have a stick. Have a stick. There you go. Good girl.
You got?
7.25.
Yeah, she's 400 down.
Wow, that's a significant amount of weight
a
loss.
lot.
It's very concerning for sure. That baby's pulling her down. We don't like pulling the joey, but if the joey is causing an issue with her health, for the safety of the joey and for the safety of the mom, sometimes we have to take the joey and let somebody hand raise it. Yeah, that one definitely was a paralysis tick. You have a head still in there.
It's not surprising Poppy's condition is so poor. Her tick infestation is much worse than first thought.
Why are there more ticks on a vulnerable, weakened animal than a healthy animal?
I think because normally they would get them off before they would attach.
Right.
So the same reason why you rarely see them in cats, where you see them in dogs, is cats clean themselves. Koalas constantly are cleaning.
Yeah, they've got the double claw.
Exactly, so they use their cleaner claw and they take them off. So she's so focused on feeding herself and eating, she's not taking, grooming and taking care of the ticks. To find ticks on a koala that tells us that there's something wrong with her immune system or with her general overall well-being.
Tim is now starting to get increasingly concerned that Poppy is far too unwell to care properly for her joey.
You're right, Paul.
The team make the difficult decision to take the joey away from its unwell mum.
You can see the arm there.
Yeah,
it's fully fed.
She's fully fed. It's actually a good state. I bet it's
There it's head.
head up.
Hey, sweetie.
Hey, honey.
Good girl, Paul.
He's a little dehydrated. His eyes are a bit sunken in his head. He's fully furred, which is a very good size to try to hand raise, and he's a little on the thin side.
Yes.
This is definitely the right decision to make. This is the baby's best chance.
Right.
Okay, baby. Okay, baby.
We've decided that the joey will be artificially reared by Hayley. Tough decision, but this is in the interest of having the joey and mum survive. And we cannot say that that's a certainty if we leave it like it is.
What's happened there?
That's a cut. That's not even part of the seat, that's the edge of the pouch.
Goodness.
As vet Robin continues to check over Poppy, she makes a shocking discovery.
She's ripped that on something,
Yeah.
probably climbing amongst the branches.
She must be in so much pain there.
Yeah, something's ripped that.
We're so lucky that she hasn't already thrown that Joey.
I know.
Okay, let's do it.
Alison is back in Brisbane and is now on her way to meet up with a very special little girl called Nola.
Nola is a rescued Staffy.
Hey, sit, Paul. Who's your good girl?
She's been awesome since we got her. She's just so good.
Nola's been lucky enough to find a loving new home with owners Emma and Daniel.
Emma fell in love with her straight away.
Pretty much
and
instantly.
She was trying to convince me, but I made her wait a couple of days and then said that I loved her as well and wanted to adopt her.
But they've put in a call to Alison to help them with their shy little girl's anxiety issues.
Nice to meet you. Can we come in?
Attention seeker, yeah, come on in.
So did the rescue centre tell you a bit about her background, where she came from?
The couple that had her got a divorce, and then the party that ended up with them said they couldn't commit because of work, and then they surrendered it.
That is quite sad to hear the history that she's been passed around.
She's also had a litter.
She's had a litter as
She's
well.
only about a little bit over 1 year old as well. Yeah.
That's young.
She was really scared of me in the beginning, so kind of felt like she was a little bit scared of men, but never to Emma. Sleeping at night time was a big issue. She was really scared about being left alone.
As a vet, we do see quite a lot of this, particularly in rescue animals or animals that are a little bit older and been adopted. They usually come with a bag full of different problems or different things that have happened in their life that's caused this anxiety. How is she outside of the house?
She's not keen around big crowds, lots of cars. She tends to go backwards in the lead and try to run back.
I am really concerned about these anxiety behaviours that Nola is showing.
Okay, come on, Nola. This way.
So we don't get on top of this at this young age, it could potentially spiral out of control. So we really want to make sure that we're doing something about it now.
Come on, it's okay.
We just want to make her happy and just make her relaxed and feel like that she's loved.
Good girl.
So we'll flush it with a little bit of saline first, just to clean off the debris. And then we'll apply a little bit of antiseptic to it.
At the Australian Reptile Park, Tim and his team have just discovered why new mum Polly has been losing condition and struggling to look after her Joey. She has a nasty tear at the opening of her pouch.
With this injury, the pouch won't close very well, and it would make it difficult for her to keep the Joey nice and warm. It would also hurt.
Yeah.
It's right in the edge.
How old do you think the injury is?
Only a day or two, not very old.
Really? Well done to the team. I mean, to pick up just on her behaviour, it's quite incredible. You think it'll heal okay?
It should. We'll have to watch it and see because it's actually the rim of the pouch.
Yes. It's all right, Paul. It's all right.
Okay, I'm almost done. Almost done. And I think probably the Joey would, every time she would move, it would hurt.
It would hurt.
Yeah. It was very important that we intervene because we probably would have lost the Joey. And if the Joey was continuing to at least get some nutrition from the mom, we potentially could have lost Polly.
She's good?
She's good.
Okay, well done, Paul. Well done. Up you go. Our best case result here is that Mum recovers because she's been under quite a burden rearing that Joey, and Joey survives with Hayley, who's done many of them. She is Koala Girl.
Hayley's gonna rear her.
Yeah.
Do you have a name?
I think in light of the recent bushfires, I think Ember would be a really nice name.
Ember.
Yeah.
I like it.
Good looking koala.
Very good looking.
In the recent 2019-20 bushfires, we lost so many wild koalas. It was just devastating. And so when we see a little Joey born like this, It just makes our heart melt.
Well, you ready for more sleepless nights?
6 months of them. Yes, always.
Come on, Nola. This way. Nola, come on.
In Brisbane, Alison can immediately see little rescue dog Nola needs urgent help with her anxiety.
Hi Ian, how are you?
Good, thank you. How are you?
So she's called on Bondi behaviouralist Ian to see if he can give some expert advice to worried owners Emma and Daniel.
What can we do for Nola?
Lots.
That's what we like to hear.
We love her a lot. We think she's very kind-natured. She's really loving and loyal, but she does have just a little bit of that anxiousness when she goes out, so we need to know how to stop that behaviour.
What we've got with her is a dog that probably has really limited exposure to the world before you guys, which means that everything it gets exposed to is going to be overwhelming.
Yeah.
So training in the home is like going to preschool. Training in the garden is like going to the secondary school. Training on the street is like going to college, and the dog park is university.
Yeah, okay.
And what people tend to do is they practice conditioning behaviours in the home and then asking them to go and pass university.
Yeah.
When we're trying to communicate with her, I want you to use food rewards. And I want you to focus on these 5 key elements. You've got come here, like go over there, so go to bed, stay, a release, like go and get it, and then the ability to interrupt verbally. So for example, if you've asked her to sit and stay, you put the food bowl on the floor, and she gets up, I just want you to go, and at that point you reward her. Or whatever noise falls out of your mouth naturally, and you get her to learn that when you interrupt, we'll look at you.
Yeah, we've never done food rewards outside of the house.
So we'll do that.
Yeah. Right. Yeah, it was really good on the call with Ian. I learned so much. He gave us some really good information, just understanding what's going on in her mind.
It's not that she's doing anything wrong, it's just we're not really sure how to deal with those types of behaviours.
Doggy. Hey Sarah, how are you?
Hi, thanks.
In Sydney, Audrey has come to check on Sarah and her much-loved Labrador Douglas. The 2-year-old has some worrying health issues.
Doggy, you look sad.
Aww.
What's going on? Hey?
Come on, Doug.
So the diarrhea is back again?
It is. It's been off and on for 2, maybe 3 months now.
Yeah. No vomiting, no blood in the diarrhea?
No.
Okay,
no,
just can't get on top of it, can we, buddy? Sura's really worried about Doug because he's been having this diarrhea for quite a while. And how's his appetite? Is that going okay?
That's fine. No lack of appetite.
Of course, that's the lab in you, hey? Even though he's eating and he's drinking, he still could have something serious going on. Not his usual bubbly self. Usually he'll be jumping all over me, doing his tricks.
Yeah, just a little bit lacking in energy.
Yeah.
I'm really glad that Audrey's here. I want to get to the bottom of this for Doug. I'm pretty concerned about him and see if we can figure out what's going on with him.
And what's that poo looking like? Is it quite soft? Is there any blood in it?
Yeah, no, not that I'm aware of any blood, no, but it's just a bit runny, a little squishy.
Audrey starts with an examination of Dougie's abdomen, hoping to find some clues as to why he's been so listless for so long.
There is a lot of movement in there, buddy. Lots of noise.
Good boy, Doug.
Did you manage to get a poo sample for me?
I did.
Yay.
I did.
Not a very nice job, but thank you very much. So what I'm going to do is run some tests on that. They're just looking for things like worms and bugs that might be in there, causing this chronic diarrhea, and then I'll pop back in.
Great, thank you so much.
All right, see you, buddy.
Good boy. Just want you back to yourself.
Or whatever noise falls out of your mouth naturally, and you get her to learn that when you interrupt, we'll look at you.
In Brisbane, Alison has organised a Zoom catch-up with an animal behaviouralist to help worried owners Emma and Daniel with their timid dog Nola.
Thanks, Ian.
See you, bang bang.
The other thing I wanted to talk to you about is some supplements that we can give Nola to help her every single day. So at this stage, because she's only 1 year of age, she's really healthy, prescription medications is just not an option. And I know that you guys are keen on something natural. And it's really simple and easy to give. It's just 2 chews a day. So we'll see how she goes. Okay?
It's good to have just a clear plan, so there's some behavioural corrections we can make and then just help that along with supplements rather than just put a band-aid on the situation just by medicating her without teaching her.
Yeah. Well, that's going to be easy then. Oh, Nola, have we got the tick of approval for flavour? She's come back for more.
So yeah, I'm excited to take what we've learned and get her.
Put it to the test.
Time for us to say bye. It was lovely to see you.
Thanks for coming today.
No worries. Have
Alright.
a lovely day. See you
See you
later.
guys. Bye.
Now I understand, like when someone gets an animal and they feel like the animal is their child. That is exactly how I feel.
Yeah.
You're a good girl. Wouldn't hurt to offer a little bit of that pap.
We don't know how long he's maybe not had any milk for, so...
No, I mean, it's fresh.
At the Australian Reptile Park, Tim and Hayley are going to try a first feed with little Ember after the Joey had to be taken away from its unwell mum.
Watch this, watch this. So, when that little head comes out, if you see a wobble, watch. When he smells it, he'll wobble his head. There you go, there's the wobble. So he's searching for it now.
The Joey needs to be fed pap or special runny poo taken from its mum so its system can get used to digesting eucalyptus.
He's just trying to figure it out. He knows he has to do something, but he's doing all the right things.
He's all instinct at the moment.
Time for you to take him home.
His mum's pouch is the perfect temperature, so it's really important to keep him at that temperature. So we'll put him in a few layers of pouches and then he'll go straight into my shirt where he'll get that warmth from. And home with me for 6 months where I become his surrogate mum.
Hopefully after 6 months, little Ember can be released into the wild.
Hey, buddy.
So what I'm going to do is run some tests on that. We're just looking for things like worms and bugs that might be in there.
Right.
In Sydney, Audrey is about to conduct a test to determine why 2-year-old Labrador Dougie has been suffering ongoing diarrhoea.
So I've got Doug's poo sample and I'm going to do a fecal float, which is a test to look for any worms or parasite eggs in the poo. I really want to find out if there are any worms inside his gut. There's fecal float and I don't like what I'm seeing here. I think we've found the cause of the problem.
Audrey has discovered Dougie has a serious infestation of roundworms.
So if we don't treat the roundworm infection, Doug could run into some serious problems. Those worms could absorb all his nutrition for growth, and also that chronic diarrhoea will cause him to get dehydrated and obviously run into severe problems later on. The good news is the infection is completely treatable.
It's time to give Dougie's owner Sarah the good and bad news.
Hey Sarah, hi Doug.
Hey, how are we? Come and sit down, baby.
So I've got some bad news. We have found out the cause of the problem and it's roundworm. So roundworm is a tummy worm. It actually lives in the gut. And when we did the fecal float, I actually saw lots of eggs floating around. That's indicative that he's got an infection and quite a nasty one. And it can cause all the signs that we're seeing with him. So it can absorb all the nutrients from his food, so he feels quite flat, and also cause that on and off chronic diarrhoea. Lucky for us, we've got a quick fix.
Great.
I brought you in some products for treating fleas, heartworm and tummy worm, and it will kill adult roundworms that are living in his gut and also the young larval stages that are migrating around his body.
Okay.
It should fix the problem, and it also means that it reduces the risk of you getting roundworm because of course it can spread to humans as well.
Oh wow.
Okay, great.
That's good news, isn't it? Yeah.
You got wormies in your tummy.
Oh, yuck. It's really good to hear that this is treatable pretty easily as well. So I'm really happy to get Doug back to himself and feeling better again.
There we go, Doug. all done.
Good boy.
So he's all good for the month, and then next month you've got to remember to reapply it, so every month for the rest of his life, and that should keep all those wormies at bay.
Oh, that's great news.
It's really important to keep up with your pet's worming because they could potentially get infected at any time. Going out for a walk, mixing with other dogs. High five. Good boy.
2 weeks later, Poppy has fully recovered from the nasty bite from another dog. Little Ember is thriving with lots of TLC from keeper Hayley, while Mum Polly is also continuing to return to full health.
Ben. Oh, that was a bit of a slow one. Good boy. High five.
A month after starting treatment for roundworms, Dougie is up to his old tricks.
Spin. Good boy. Catch.
His chronic diarrhoea is gone, and his monthly medicine should keep him from further infection.
Come on, give me 5. Yeah, good boy.